want to begin by thanking Jack and his team, construction crew, and everybody who made this extraordinary day possible. This is not only a momentous occasion for the city of Burlington or Chittenden County, this is a huge step forward because for the state of Vermont in making sure that every Vermonter gets the health care that they need as a right and not a privilege. So this is a beautiful day. I think, and I speak as the chairman of the subcommittee on primary health care in the Senate, everybody here knows that this country faces a significant health care crisis. We know that 50 million Americans and many Vermonters have no health insurance at all, and we also know that every single year 45,000 people die because they don't get to a doctor when they should. And the reason that I am such a strong advocate of the Community Health Center program is A, it provides health care to all people in the community regardless of their income because it provides a sliding scale. Second of all, it deals with the issue of dental care. And we have here a beautiful, beautiful new dental facility, something in need in all over our state. Thirdly, many of you know, the doctors here know, that doctors write prescriptions for their patients, and what happens? Their patients can't afford to fill those prescriptions. And what we're doing here is providing the lowest cost prescription drug program in America through the 340B program. We're providing mental health counseling, substance abuse programs as well. And at the end of the day, do you know what else we're doing? We are saving taxpayers money because when people walk into this facility, it costs about 10% of what it costs to go to the emergency room. And we're providing a medical home for people for their long-term primary health care needs. Furthermore, we are addressing, when we address the primary health care crisis in America, what we are saying is that when people get sick, they should be able to walk into a medical facility, not stay home and get sicker and sicker and sicker, and then end up in the hospital where we're spending tens of thousands of dollars taking care of somebody who could have been treated for a fraction of that cost if there was a primary health care facility available. I am very proud, along with Senator Leahy and Congressman Welch, working with the President of the United States, Barack Obama, who understands the importance of community health centers. We made real progress in the stimulus package. We got $2 billion to help build facilities all over this country, including this beautiful facility here. And also, in the much maligned health care reform bill, we doubled funding for community health centers. We're going to go from 20 million Americans getting their health care to 40 million Americans all over this country and in the state of Vermont. That is pretty good. And as Jack mentioned, here in this state, in the last 7 or 8 years, we've gone from 2 to 8 FQHCs with now 45 locations. 120,000 Vermonters, 17% of our population, is now getting quality, affordable health care at a community health center in their community. 25,000 Vermonters are now getting dental care in the state of Vermont. So, in the midst of a major health care crisis, we in Vermont are making significant progress in addressing primary health care and primary dental care. The goal must be to see that every Vermonter in every community in this state has access in those areas where they live to primary health and dental care. We're making progress. I just want to conclude by congratulating Jack and his staff and his fine medical team. This is, if you haven't seen it yet, just an extraordinarily beautiful facility. And as Senator Leahy indicated, this is a right. This is where federal money should be going. And this is a huge step forward for this community and the state. And I want to thank everybody who made this day possible. Thank you all very much.